Maintaining knee strength and function becomes increasingly important after age 60. While standing exercises are valuable, seated exercises provide a safe, accessible option for building knee-supporting strength, particularly for those with balance concerns, arthritis, or limited mobility. Today we're covering 5 seated exercises that target muscles essential for knee health: quadriceps, hamstrings, hip abductors, adductors, and lower leg muscles. Each can be performed from a sturdy chair with minimal or no equipment. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have existing knee conditions, recent injuries, or other health concerns. Understanding seated exercise benefits: seated exercises offer specific advantages for older adults. They eliminate balance challenges, making exercises safer for those with stability concerns. They reduce fall risk during exercise. They allow focus on proper form without worrying about balance. They're accessible for those with significant mobility limitations. And they can be performed almost anywhere with just a sturdy chair. For knee health specifically, the muscles surrounding the knee joint provide crucial support. Strong quadriceps reduce pressure on knee cartilage. Strong hamstrings balance the joint and support stability. Hip muscles, particularly abductors and adductors, control knee alignment during movement. Strong lower leg muscles support ankle stability, which affects knee stress. Seated exercises can effectively target all these muscle groups. Exercise 1, Seated Knee Extension for Quadriceps Strength. The first exercise is seated knee extension, which strengthens the quadriceps muscles on the front of your thigh. These muscles are critical for knee stability, standing from seated, walking, and stair climbing. Weak quadriceps are associated with increased knee pain, reduced walking ability, and higher fall risk in older adults. Here's how to perform seated knee extension. Sit upright in a sturdy chair with your back supported, feet flat on floor, knees bent at approximately 90 degrees. Slowly straighten your right leg, extending your knee as fully as comfortable. Your thigh should remain on the chair seat. Hold the extended position for 2 to 3 seconds. Slowly lower your foot back to the floor with control. That's 1 repetition. Perform 10 to 15 repetitions per leg. Rest briefly. Complete 2 sets per leg. Practice 3 to 4 times per week. Important form points: keep your thigh on the chair throughout, don't lift your entire leg. Extend only as far as comfortable, full extension isn't required. Move slowly with control, avoid fast jerking movements. Keep your upper body upright and stable. Modifications: if full extension is uncomfortable, extend only partway. Progress gradually over weeks. If the exercise feels too easy, hold the extended position for 5 to 10 seconds. You can add light ankle weights once bodyweight version is mastered. Start with 1 to 2 pounds. What to realistically expect: with regular practice 3 to 4 times per week over 6 to 10 weeks, you may notice improved quadriceps strength for standing and stairs, better knee stability during walking, possible reduction in anterior knee pain in some cases, and improved confidence in knee function. Quadriceps strength building is gradual. Expect steady improvement over months, not rapid changes. Exercise 2, Seated Hamstring Engagement with Heel Press. The second exercise is seated hamstring engagement through heel press, which activates hamstrings without requiring standing or prone positioning. Hamstrings on the back of your thigh help stabilize the knee, support hip extension, and balance the forces acting on your knee joint. Here's how to perform seated hamstring engagement. Sit upright near the front edge of a sturdy chair, feet flat on floor, hip width apart, knees bent at approximately 90 degrees. Press your heels firmly into the floor as if trying to drag them back toward the chair without actually moving them. You should feel contraction in the back of your thighs, your hamstrings. Hold this contraction for 5 to 8 seconds while breathing normally. Release slowly. Rest for a few seconds. Perform 8 to 12 repetitions. Complete 2 sets. Practice 3 to 4 times per week. Key points: this is an isometric exercise, meaning muscles contract without joint movement. Focus on feeling the back of your thighs working, not your feet or calves. Press firmly enough to feel muscle engagement but not so hard it causes cramping. Keep your upper body stable and upright. Modifications: if you have difficulty feeling hamstring engagement, try pressing one heel at a time. You can place your hands on the back of your thighs to feel the muscles contract. For more challenge, increase hold duration to 10 seconds or press harder. What to realistically expect: with consistent practice 3 to 4 times per week over 4 to 8 weeks, you may notice improved hamstring awareness and activation, better knee joint stability, improved ability to control knee during movement, and balanced muscle strength around knee joint. Isometric strength builds gradually and supports functional movements. Exercise 3, Seated Hip Abduction for lateral knee stability. The third exercise is seated hip abduction, which strengthens hip abductor muscles that control lateral knee alignment. Your gluteus medius and other hip abductors prevent your knees from collapsing inward during standing and walking. Weak hip abductors contribute to knee valgus, the inward knee collapse that increases knee stress and injury risk. Here's how to perform seated hip abduction. Sit upright in a sturdy chair, feet flat on floor, hip width apart. Keeping your foot on the floor, slide your right leg out to the side as far as comfortable. Your knee and ankle should move together. Hold briefly at the furthest comfortable position. Slide your leg back to starting position with control. Perform 10 to 15 repetitions per leg. Complete 2 sets per leg. Practice 3 to 4 times per week. Important technique: keep your foot in contact with the floor throughout. This isn't a leg lift. Move from your hip, not by twisting your upper body. Keep your torso upright and stable. Move slowly and with control, not quickly. Modifications: if sliding on floor is difficult, lift your foot slightly and move it out to the side, then place it down. For increased challenge, loop a resistance band around both thighs just above your knees. Press outward against band resistance. This significantly increases hip abductor work. What to realistically expect: with regular practice 3 to 4 times per week over 6 to 10 weeks, you may notice improved hip strength and control, better knee alignment during standing and walking, reduced tendency for knees to collapse inward, and improved lateral stability and balance. Hip abductor strength directly impacts knee health and alignment during functional activities. Exercise 4, Seated Adductor Squeeze for inner thigh strength. The fourth exercise is Seated Adductor Squeeze, which strengthens inner thigh muscles that control medial knee stability. Your adductors help control knee position, support pelvic stability, and contribute to overall lower body control. Here's how to perform Seated Adductor Squeeze. Sit upright in a sturdy chair, feet flat on floor. Place a firm pillow, yoga block, or rolled towel between your knees. Your knees should be hip width apart or slightly closer. Gently squeeze the object between your knees, engaging your inner thigh muscles. Hold the squeeze for 5 to 8 seconds while breathing normally. Release slowly. Rest briefly. Perform 8 to 12 repetitions. Complete 2 sets. Practice 3 to 4 times per week. Form reminders: squeeze with inner thighs, not by leaning forward or using momentum. Keep your upper body upright and stable throughout. Breathe normally, don't hold your breath during squeezes. The squeeze should feel like moderate effort, not maximum contraction. Modifications: use a softer object for easier version, firmer object for more challenge. Vary hold duration: shorter holds like 3 seconds are easier, longer holds up to 10 seconds are more challenging. You can perform without any object, simply squeezing knees together, though object provides tactile feedback. What to realistically expect: with consistent practice 3 to 4 times per week over 4 to 8 weeks, you may notice improved inner thigh strength, better knee control during movement, reduced knee wobbling during walking, and improved overall lower body stability. Adductor strength supports knee alignment and pelvic stability. Exercise 5, Seated Ankle Dorsiflexion and Plantar Flexion for lower leg strength. The fifth exercise is seated ankle movement targeting lower leg muscles, specifically dorsiflexors that lift your foot and plantar flexors that point your foot. While these aren't knee muscles directly, lower leg strength significantly impacts knee health. Strong ankle muscles improve balance, reduce fall risk, support proper walking mechanics that protect knees, and improve circulation in lower legs. Here's how to perform seated ankle exercises. Sit upright in a sturdy chair, feet flat on floor. Lift your toes and front of your feet off the floor while keeping heels down. You should feel your shin muscles working. Hold briefly, then lower. That's dorsiflexion. Now lift your heels off the floor while keeping toes down. You should feel your calf muscles working. Hold briefly, then lower. That's plantar flexion. Alternate between toe lifts and heel lifts. Perform 10 to 15 of each. Complete 2 sets. Practice daily or most days of the week. Key points: move through comfortable range, full range isn't required. Keep movements controlled and deliberate, not bouncy. You can perform these separately, all toe lifts first, then all heel lifts or alternating. Focus on feeling the muscles working in front and back of lower leg. Modifications: if exercises feel too easy, hold each lift for 3 to 5 seconds. You can place light weight, like a small book or water bottle, on your knees for added resistance. For more challenge, perform single leg at a time. What to realistically expect: with daily or near daily practice over 4 to 8 weeks, you may notice improved ankle mobility and strength, better balance and stability during standing, reduced ankle stiffness, improved circulation in lower legs, and better walking mechanics that protect knees. Lower leg strength is foundational for knee health and fall prevention. Creating a seated knee exercise routine. Here's how to incorporate these 5 exercises into a manageable routine. You don't need to perform all 5 every day. Start with 2 to 3 exercises that address your areas of greatest need. A complete routine takes 10 to 15 minutes. Sample routine 3 to 4 times per week. Seated knee extension, 2 sets of 10 to 15 reps per leg. Seated hamstring heel press, 2 sets of 8 to 12 reps. Seated hip abduction, 2 sets of 10 to 15 reps per leg. Seated adductor squeeze, 2 sets of 8 to 12 reps. Seated ankle movements, 2 sets of 10 to 15 each direction. Daily or most days, perform ankle exercises which take only 3 to 5 minutes. These support circulation and can be done while watching television or reading. Important context and limitations: seated exercises support knee health but exist within broader context. They're excellent for building strength safely but don't replace weight-bearing activities if you're able to perform them. Weight-bearing exercises provide additional bone density benefits. They may not be sufficient alone if significant knee problems exist. Medical evaluation and treatment may be necessary. They work best combined with appropriate walking or other activity as tolerated, proper nutrition for muscle and joint health, and medical management of arthritis or other knee conditions if present. You should consult a healthcare provider or physical therapist before beginning if you have recent knee surgery or significant injury, severe arthritis with constant pain, uncertainty about appropriate exercises for your specific knee condition, or if knee pain significantly worsens with these exercises. Monitoring your progress when exercising for knee health. Track how your knees respond. Positive signs include feeling stronger during daily activities, less knee stiffness after sitting, improved confidence during movement, and ability to progress exercise difficulty over time. Concerning signs include sharp pain during exercises, significant increased swelling after exercises, knee instability, or giving way, or consistent worsening of symptoms. If you experience concerning signs, stop the problematic exercise and consult your healthcare provider. Some mild muscle soreness is normal when starting new exercises, but joint pain is not. Realistic timeline for improvements. Knee strength improvements are gradual. Weeks 1 to 3, learning proper form and technique, beginning neuromuscular adaptations, possibly mild muscle soreness which is normal. Weeks 4 to 8, exercises feel more natural and controlled, some functional improvements may be noticeable, ability to increase repetitions or resistance. Months 3 to 6, clearer improvements in knee stability and strength, better performance of daily activities requiring knee strength, established sustainable routine with continued progress. The goal isn't rapid transformation but gradual sustainable improvement that supports long-term knee function and mobility. Conclusion: these 5 seated exercises, knee extension for quadriceps, hamstring engagement through heel press, hip abduction for lateral stability, adductor squeeze for medial control, and ankle movements for lower leg strength, provide a comprehensive approach to supporting knee health from a seated position. They're accessible, safe, and effective for building the muscle strength needed to protect and stabilize knee joints. Start with 2 to 3 exercises that address your greatest needs. Practice consistently 3 to 4 times per week. Progress gradually by increasing repetitions, hold times, or resistance as appropriate. Listen to your body and modify as needed. These exercises support but don't replace comprehensive medical care for knee problems when needed. Thank you for watching. For specific concerns about knee exercises appropriate for your situation, consult with a physical therapist or healthcare provider for personalized guidance. Subscribe for evidence-based information on joint health and safe effective exercise for older adults, practical guidance that respects individual limitations while providing actionable steps for maintaining mobility and independence.